It is very clear that some people are significantly more vulnerable to COVID-19, and this is something I'm determined to understand in full and take action to address.
Is COVID racist? Let's take a look.
Break it down.
Ever since the start of this pandemic, we've been made aware by the news media that black and brown people are the most at risk of COVID.
It's about 35% of the population being admitted to hospital are from BAME communities.
We need to urgently investigate why people from BAME backgrounds appear to be more at risk from coronavirus.
People from black, Asian and minority ethnic backgrounds are at greater risk of becoming seriously ill with COVID-19.
65% of all NHS workers who have died from COVID-19 are from a black, Asian or minority ethnic background.
When inquired into, has kind of drawn a blank.
In fact, no, we can't explain, and it's staggering.
I don't understand why that would be different.
Now, this week on Monday, Channel 4 released a one-off documentary introduced by a Dr. Ronix Akaria, delving in and investigating the reasons to why the black and Asian community were being mostly affected by COVID.
Around a third of patients in intensive care units are BAME, black, Asian and minority ethnic. And this compares to them being about 14% of the population of England and Wales. Still only 20% of staff, and I think it's 44% of medical staff, so it's still really disproportionate.
That in black ethnic groups, 486 women and 649 men were diagnosed with COVID-19 per 100,000 population, whereas in white groups the number is significantly lower, 220 women and 224 men per 100,000 population. People of Bangladeshi ethnicity had almost twice the risk of death, and people of Chinese, South Asian and other black ethnicities had between 10 and 50% higher risk of death when compared to white people.
If you haven't seen this, I suggest you go watch it. But many people who hadn't watched it and had seen the title were obviously, as they generally are, outraged and went to Twitter to express their outrage. But generally, you could tell most of them haven't watched the show. If they had have done, they wouldn't have drawn the conclusions they had, because the title is somewhat clickbait or at best ironic, because ultimately COVID is not racist, which within 15 minutes of watching the documentary you will find out.
Because many people have died and we want answers, and it just cannot keep being that if the word racism is mentioned, people run for the ill.
Now, she investigates by, checking out certain hospitals across the country, speaking to different medical experts, and trying to delve into what are the causes of the higher percentage and affecting the BAME community.
One is poverty. That affects your susceptibility to certain diseases, and BME people tend to be overrepresented in people on lower incomes.
Now, by the end of the documentary, it becomes quite apparent that the reasons for the disparity is poverty and the higher percentage of black and Asian people working in jobs that are public facing.
For example, many couriers are BAME, and couriers are one of the professions that are still working throughout COVID. Similarly, bus drivers, and I think 25% of TfL staff are from a BAME background.
It's a stark observation, and one which has crippled so many families.
Obviously, with the prevalence of this in the news, the government have showed their concerns by commissioning a report.
It's caused anger and upset amongst BAME communities. Remember, this report was supposed to make recommendations about how to protect those communities from their increased risk from COVID-19.
Done by our Equalities Minister, Kimi Badenoch, which this summer was created some controversy as certain parts of it were not released.
The decision not to publish this report against the backdrop of the Black Lives Matter protests has been hugely controversial. Labour has been hugely critical of the statements that the Minister made in the Commons, and they've written to Matt Hancock tonight, Dawn Butler has, asking him if those statements can be corrected. At the start of the pandemic, when it became apparent that Black, Asian and minority ethnic communities were being unequally affected by COVID, the government ordered a review.
The Professor Fenton, who was charged with heading the investigation into the causes.
Recommendations were made by Professor Kevin Fenton, who engaged with thousands of people from BAME communities across the country. And what they consistently told him was that the issue of structural racism had a huge part to play, a report that has still not been published. It recommends that comprehensive data on ethnicity must be collected to help mitigate the impact of COVID-19 on the BAME community. It calls for more research into the social, cultural, structural and other determinants on the spread of the virus amongst ethnic minority groups. And it calls for culturally competent risk assessment tools and prevention campaigns. Crucially, Professor Fenton concluded that his sessions had found, without explicit consideration of ethnicity, racism and structural disadvantage in our responses to COVID-19 and to health inequalities, there is a risk of partial understanding of the processes that produce poor health outcomes.
After being instructed by the government a month and a half ago, Public Health England released its review looking at why people from a BME background are disproportionately affected.
So obviously they got a lot of kickback from the Black and Asian community as a result of it, and then released the report. Our Qualities Minister, Kimi Badenoch, you know, the woman that likes to gaslight the individual she's supposed to be taken care of. You know, she's the Equality Minister for women, for race, for disabilities, and all people generally who are deemed to be vulnerable. And in her usual tradition, she wants to gaslight those who question some of the decisions she's made. Take a look at what she had to say to a Labour minister when she was confronted about the report in Parliament.
Professor Fenton's report, finally published yesterday, highlights yet more evidence that socio-economic inequalities, racism and discrimination are root causes to BAME communities being disproportionately harmed by COVID-19, and that these injustices were already known and has already cost lives. The government's denial and delay further compounds despair at their lack of care and concern. The 7 practical recommendations the government should have taken much sooner include risk assessing our Black and minority ethnic workers on the front line. Black Lives Matter is more than just a slogan. So what immediate and decisive action will the Minister take now to develop and deliver culturally competent occupational risk assessment tools?
Minister.
Mr. Speaker, I refer again to the ministerial statement which was laid yesterday, which does cover this. The government did not delay publishing any reports, and recommendations which were published, most of which the actions are already in train, can be seen on the gov.uk website.
So then, interventions or the lack thereof. This government has failed by its own report to act on any of the conclusions drawn from Professor Fenton. He suggested many causes or contributing factors to why there was a disparity between Black and Asians amongst Britain, as they only make up 14% to the 85% of the white community, which obviously, you know, drives more questions, but the government has delivered no answers by ignoring his conclusions. So what do we have there? What we have is the media, again, downplaying the effects or the underlying effects that lead to the disproportionate effect within the Black and Asian community. Now, let's make one thing clear. Black and brown people don't have a higher percentage chance of catching COVID-19. The only difference is they have less choice Often, when it comes to nurses, for example, who work in the NHS, often they work for agencies. They don't have much say on whether they take time off, whether they can go off sick, because often they won't get more work. You know, we have, you know, other civil servants, bus drivers, and also as well, what exacerbates the whole situation is poverty. Now, if you're in this country and you're poor, you're more likely to not be able to guard yourself against the getting infected or infecting others with COVID. That's just simple. That's what all the statistics are saying. Regardless of, you know, the disparity amongst Black and Asian, it's only a disparity because they're more highly represented in the jobs that are front facing, that are working alongside the virus. Let's take a look at other forms of media that are not our mainstream, such as the BBC, ITV, Sky News, so on. Let's take a look at Al Jazeera and RT News, and let's see what or how they represent these same facts and data compared to our news media, our mainstream news media or legacy media.
He caught the virus in hospital while being treated for cancer, his death adding to a disproportionately high toll among Black, Asian and minority ethnic groups over their white counterparts. Disparities are blamed on a broad range of social and economic inequalities, but now a government-commissioned report cites racism specifically as a factor. The report points to racism and discrimination experienced by communities and more specifically by BAME key workers as a root cause affecting health and exposure risk and disease progression risk. Among its recommendations, change needs to be large-scale and transformative to reduce inequalities.
Things like race and discrimination, you know, Black nurses are telling us they're being forced to the front line while their matrons who are not Black or from a minority ethnic are giving orders from the comfort of their home.
Break it down!